Your blood sugar is silently killing you, and you might not even know it yet. Over 537 million people worldwide have diabetes. And the number is growing every single day. It doesn't just affect your blood sugar. It attacks your heart, kidneys, eyes, and nerves. But here's the good news. Diabetes can be controlled, managed, and in many cases, even reversed. Stay with me, because in this video, I'm going to break down everything you need to know about diabetes. Diabetes is a condition where your body can't properly manage blood sugar, also called glucose. Normally, a hormone called insulin acts like a key. It opens your cells to let sugar in for energy. In diabetes, either your body doesn't make enough insulin, or your cells stop responding to it. The result? Sugar builds up in the blood, damaging vessels, nerves, and organs over time. This leads to heart disease, kidney failure, blindness, nerve damage, and even amputation. The scary part: millions of people have diabetes for years without any symptoms at all. In fact, 1 in 2 people with diabetes are completely unaware of their condition. A simple blood test is all it takes to find out. Please get tested if you haven't already. Now let me explain the different types of diabetes, because they are not all the same. Type 1 diabetes is an autoimmune disease. Your own immune system destroys the insulin-producing cells. It usually appears in children and young adults, and it is not caused by diet or lifestyle. People with type 1 must take insulin every single day for life. There is currently no cure. Type 1 accounts for about 10% of all diabetes cases worldwide.
It usually appears in children and young adults, and it is not caused by diet or lifestyle. In diabetes, either your body doesn't make enough insulin, or your cells stop responding to it.
Type 2 is the most common form, making up 90% of all cases globally. It is strongly linked to obesity, poor diet, lack of exercise, and aging. In type 2, your body still makes insulin, but your cells become resistant to it over time.
Changes are working.
That's a relief. What should I keep doing?
Keep up the exercise and diet, we'll monitor. Type 2 is the most common form, making up 90% of all cases globally.
Cause number 1, genetics. If your parents or siblings have diabetes, your risk is significantly higher. Obesity is the biggest trigger for type 2. Excess fat, especially belly fat, causes insulin resistance. A sedentary lifestyle with no exercise increases insulin resistance dramatically over time. A diet high in sugar, refined carbs, and processed food spikes blood sugar repeatedly, exhausting the pancreas. Chronic stress raises cortisol levels, which directly raises blood sugar and promotes fat storage. Poor sleep and sleep disorders like sleep apnea are strongly linked to insulin resistance and diabetes. Smoking and heavy alcohol use both damage the pancreas and increase diabetes risk significantly. As we age, our cells naturally become less sensitive to insulin, making older adults much more vulnerable. Now for the most important part: how do we treat and control diabetes? Let's start with food. Food is your most powerful medicine. The right diet can reverse prediabetes and control type 2 diabetes. Bitter gourd, also called Karela, is one of the most powerful natural blood sugar controllers known to science. Cinnamon improves insulin sensitivity. Just half a teaspoon daily can meaningfully lower blood sugar levels.
In the USA alone, 96 million adults have prediabetes, and most don't know it. If ignored, prediabetes progresses to type 2 diabetes within 5 to 10 years.
Oh, my sweet baby, you're so perfect. She's doing beautifully, very healthy baby. I'm so relieved.
Gestational diabetes occurs during pregnancy when hormones interfere with insulin function. It usually resolves after birth, but increases the mother's risk of type 2 diabetes later in life. Now let's look at the main causes and risk factors that lead to diabetes. Fenugreek seeds soaked overnight and consumed in the morning are proven to lower fasting blood sugar. Replace white rice and white bread with whole grains. They digest slowly and prevent blood sugar spikes. Healthy fats from avocado, nuts, and olive oil improve insulin sensitivity and keep you full longer. High-protein foods like fish, eggs, and lentils slow digestion and stabilize blood sugar after meals. Apple cider vinegar taken before meals has been shown in studies to lower post-meal blood sugar by up to 20%. Completely avoid sugary drinks, white flour products, fried food, and ultra-processed snacks. Intermittent fasting, eating within an 8-hour window, is one of the most effective tools to reverse type 2 diabetes. Controlling portion sizes alone, even without changing what you eat, can significantly lower blood sugar. Now let's talk about how exercise acts like natural insulin for your body. Exercise is the closest thing to a miracle drug for diabetes. Even a 30-minute walk makes a huge difference. When you exercise, your muscles absorb glucose directly, without needing insulin at all. Brisk walking for 30 minutes daily can lower HbA1c, the long-term blood sugar marker, by up to 1%. Resistance training builds muscle mass, and more muscle means more glucose storage and better insulin sensitivity. Any cardio you enjoy, swimming, cycling, or dancing counts. Consistency matters more than intensity. Yoga reduces cortisol and stress hormones, directly lowering blood sugar and improving insulin response. A 10-minute walk after every meal is one of the most effective strategies to prevent blood sugar spikes. High-intensity interval training, or HIIT, is especially powerful at burning blood sugar fast. Sitting for more than 30 minutes at a time raises blood sugar. Stand up and move every half hour. Now let's cover the main medications doctors use to treat diabetes. Metformin is the most commonly prescribed diabetes medication worldwide. It reduces glucose production in the liver. GLP-1 drugs like Ozempic and Wegovy are revolutionary. They lower blood sugar and cause significant weight loss. Insulin injections are essential for type 1 and for type 2 patients when other medications are not enough. SGLT2 inhibitors like Jardiance remove excess sugar through urine, and also protect the heart and kidneys. DPP-4 inhibitors like Januvia stimulate insulin release after meals with a low risk of side effects. Modern CGM devices track blood sugar 24/7 without finger pricks, a game changer for diabetes management. Always work with your doctor to find the right medication. No one treatment works for everyone. The best results come from combining medication with food, exercise, and lifestyle changes together. Before we wrap up, here are the most important takeaways from this entire video. Tip 1. Get your blood sugar tested. Early detection saves lives. Tip 2. Eat whole foods. Avoid sugar, white flour, and processed food every single day. Tip 3. Move your body for at least 30 minutes every day. No excuses. Tip 4. Lose even 5 to 10% of your body weight. It dramatically improves blood sugar control. Tip 5. Manage stress and prioritize 7 to 8 hours of quality sleep every night. Tip 6. See your doctor regularly. Monitor your HbA1c, blood pressure, and kidney function. Remember, diabetes does not have to control your life. You can take control of it. If this video helped you, please like, share, and subscribe. It really helps this channel grow. Drop your questions in the comments below. I read every single one and will answer them. Thank you so much for watching. Stay healthy, stay strong.